So before entering the room, I'm going to enter with my stethoscope and my pen light. So those are the tools that I'll be using. So,
Come in.
hi, my name is Evelyn. I'm going to be your student nurse today. Let me just go ahead and wash my hands. So I'm going to wash my hands for 20 seconds per CDC guidelines. I'm going to don some gloves. I'm going to approach the patient. So hi, I'm going to lower the railing and I'm going to higher the bed to a comfortable working level. I'm going to verify. So can I have you tell me your first and last name and your date of birth for me, please?
Kiana Riley, September 6, 1995.
Okay, can I see your wristband? I'm going to compare that with her wristband that she has. And I'm also going to scan her in with the computer just to check again. Okay, do you have any allergies that I should know about? No allergies?
Mm.
Okay, so I'm going to document that. I'm going to, do you ask her if she feels any pain? Do you feel any pain today?
Nope.
No pain?
Yes, I have pain.
Okay.
Right here in my right shoulder.
Okay, so for your pain on your right shoulder, what does it feel like?
It feels like a sharp pain.
Sharp pain? Does it radiate anywhere? Or does it stay in that just one spot?
It's just this one area.
Okay, on a scale from 0 to 10, 0 being no pain at all and 10 being the worst pain, where would you rate that?
2.5.
Okay. And when did this pain start?
Yesterday.
Yesterday? Is there something that you do that makes it feel better or worse?
It feels better when I'm laying down.
When you're laying down?
Mm-hmm.
Okay. And I'm going to document everything that she's telling me. So now I just want to let you know that we're going to do a full head-to-toe assessment on you today. It involves me touching you. Is that fine?
Mm-hmm.
Okay, so I'm going to go ahead and get started. I'm going to start from the top of your head all the way to the tips of your toes, okay?
Okay.
So I'm going to start the assessment with her scalp. So I'm starting with looking at for any abnormalities, any infestation of like lice, the even distribution of her hair, and any dandruff, anything like that. And now I'm going to move on to her ears. I'm going to pull the ear back, use my pen light to see if there is any cerumen buildup. I'm going to check the skin integrity around the ear and the ear itself. I'm going to touch for any tenderness. Okay, Kiana, do you wear any hearing aid or assisted hearing devices?
No.
Okay. So now I'm going to move on to her eyes, and I'm going to be assessing PERLA. So that's pupil equal, round, and reactive to light accommodation. So just look straight ahead. Okay, and then I'm going to do the 6-point gaze. If I can have you look at the tip of my pen with just your eyes. Okay, and then keep looking. Okay, great. I'm going to check the eyes. I'm going to check the conjunctiva to see if it is irritated, inflamed. It should be pink. The sclera is white. I'm checking for any drainage, any leakage in the eye. I'm going to check for facial symmetry. Can I have you go ahead and smile? Okay, can I have you move your eyebrows? Okay. So I'm also going to check the sensation if she feels on her face with using my finger. Can you feel this? Can you feel it?
Yes.
Okay. Okay. So now we're going to move on to her nose. I'm going to take a look inside of her nose. If I can have you lift up a little. I'm going to be checking for a deviated septum, any leakage. I'm also going to be checking the outer appearance of her nose, skin integrity to make sure everything's intact and okay. Do you wear any glasses?
Reading glasses.
Reading glasses? Okay. And then do you get frequent nosebleeds at all?
Never.
Okay. So now I'm moving on to her mouth. Before asking to open up the mouth, I'm going to look at the lips to make sure they're not chapped, any dried lips, any sores, any cuts. Okay, now can I have you open up your mouth? I'm going to be looking at the moisture in her mouth. I'm also looking at the tongue to see if it's inflamed. I'm also going to be looking for bleeding gums. And then if I can have you lift your tongue up, I'm looking for any dark spots underneath the tongue because it could be signs of cancer. And then you can go ahead and close your mouth. Are those all your teeth, or do you have dentures?
They're my teeth.
They're her teeth. Okay, and everything that I'm getting, I'm documenting it down. Okay, so now I'm moving on to your neck. So I'm going to start with the lymph nodes, and I'm going to go ahead and check for any lymph nodes, any marbling or grain-like feeling. So I'm checking the pre-auricular, the post-auricular, the tonsillar, the postmandibular, premental, the superficial cervical, deep cervical, and the posterior cervical, and then clavicular. And then now I'm going to check for JVD, jugular vein dissension, so if I can have you turn that way. Okay, and I can have you turn the other way. And no sign of JVD. I'm also going to check the midline of her trachea. Do you have trouble swallowing? Okay, go ahead and swallow for me. Okay, so it's in midline. I'm also looking to make sure that there's no signs of goiter, so the inflamed thyroid. And now I'm moving on to assess her skin. So now I'm going to move on to assess your skin. I'm going to check her skin I'm going to check the temperature using the dorsal part of my hand. I'm also going to look inside to make sure that if she has any tubing, any IVs, that I go ahead and document that too. I'm also going to look around the IV site if she does have one for any tenderness, any inflammation, any redness. And then I'm going to check for the color of her skin. Is she cyanotic? Is she pale? Is she clammy? Also going to be checking for symmetry of her hands. So I want them to be the same. I'm also I want to check her range of motion. If I can go ahead and have you lift your hands up in the air. Can I have you wiggle your fingers? Can I have them out? Wiggle your fingers then too, and then back in front of you. Okay. So I'm checking her range of motion. I'm going to check her strength. Can I have you push against my hands? Okay. On the sides, on top. Okay. And then if I can have you grip my fingers. Okay, perfect. And then I'm going to check the capillary refill of her fingers. And if she has nail polish, I want to look on the other side because it's going to be hard to tell if she has nail polish on her hands. Okay. So now I'm going to move on to, I'm going to check her skin trigger. I'm going to check if she's dehydrated or not. Has to be less than 3 seconds to return back to normal. Checking for possible edema. And I'm going to move on to I'm going to check all of your pulses before I move on. So I'm going to start with I already checked the carotid on both sides to make sure not to do them at the same time. I'm going to check her brachial bilaterally, her radial, ulnar, popliteal, posterior tibialis, and pedal dorsal pedis. So then I'm going to move back. I'm moving on to the chest. I'm going to let you know, I'm going to uncover your chest. Is that okay? Because we're going to examine that part of your body now. So I'm going to lower her gown. I'm going to assess for symmetry. I want to watch the inhale and exhalation of her chest and how it rises and falls. I'm going to see for, symmetry and coloration, any bruising, stuff like that. And so do you smoke?
No.
No? Do you have any history of respiratory disorders?
No.
Okay. Also, do you have a cough?
No.
Okay. And so I asked those before, and I'm going to go ahead and listen to your lungs.
Okay.
Okay. I'm going to start. So there's going to be 6 on this side and 6 on this side. I'm going to start up here, and I'm going to work my way to the right and then down and to the left and then down. And I'm hearing for her inhale and exhale on each placement. 1, 2, I'm checking that. So now I'm going to go ahead and check her heart since I'm in this area already. And I'm checking the aortic valve, the pulmonic, herbs, tricuspid, and mitral. Now I'm going to move on to her abdomen area. I'm going to, before touching the abdomen at all, I want to just inspect it because I don't want that to create sounds that shouldn't be there. Okay, so I'm going to listen. I'm going to inspect for any masses, distensions, any lesions, any bruising, and then I'm going to go ahead and listen into her abdomen for any hyperactive or hypoactive bowels. I'm going to start at her right lower quadrant, upper right quadrant, upper left quadrant, lower left quadrant, and I'm going to hear for 30 seconds. If I don't hear anything from 30 seconds to a minute, then I have to go back and hear each quadrant for 5 minutes. Do you have, when was your last bowel movement?
Yesterday.
Okay, and was that, would you say difficult or soft?
It was soft.
Okay, and then what color?
It was brown.
Okay, and then do you have you experienced nausea or vomiting?
No.
No? Okay. And for your urination, is it, do you notice blood in your urine?
No.
Okay, is it difficult to urinate?
No.
Okay. Now I am moving on to your legs. I'm going to skip over the perineal area till the very end before I turn her over, so I'm going to come back to that. So now I'm going to assess her legs. So again, I'm going to check for her capillary refill on her toes. I'm going to check for possible edema. I want to check her strength and range of motion on her toes, or her legs. So if I can have you lift your leg up and out. Okay, the other one. Okay. And then if I can have you pull against me. Great. And then push. Okay. And then I'm going to check for possible edema. Okay, I'm going to check to see if I'm going to move it this way. Okay, and I'm going to check the sides, her bony prominences, to see if she has any impaired skin integrity. I'm going to check the thickness of her toenails, the in-between of her toenails, to see if there is any skin breakdown. And then that's it for her feet. So now I'm going to go back up into the perineal area. I'm going to check, if it's dirty or I can't work with, I'm going to go ahead and clean that. And if it is, then I'm going to assess for any lesions, any blisters, any bruising, any tubing, and I'm going to go ahead and document that too. And I'm checking for that. So then now we're done with the front area. So I'm going to, still with those gloves on, I'm going to have you turn over for me, and I'm going to check the back part of her perineal area. Okay, so I'm checking again for any tubing and documenting that too. So now I'm done with that. I'm going to take my gloves off and dispose of them. And then I'm going to don new gloves. Put new gloves on, and I'm going to examine her back now. So in the back, before touching, I'm going to look for any, I'm going to look at the coccyx area to see if there's any breakdown. I'm going to see the lining of her spine to make sure it's in position. I'm going to see if there's any moles, any discoloration, and then I'm going to now assess the lungs. Can I have you sit up towards the camera this way? Thank you. So now for her lungs, I'm going to do the same method I was for the front ones. I'm going to start with up here, and there's 8 on each side. So I'm going to start up here, 1, 2. Okay, and that was 8, and then I can have you lie back down. Okay, so I'm gonna go, I finished that, now I'm gonna go back and check her loss of consciousness. So Kiana, do you know where you're at right now?
Yes. I'm at the hospital.
Okay. Do you know what year it is?
2020.
Do you know who I am?
My nurse, Evelyn.
Okay. Do you know who the president is?
Donald Trump.
Okay, so she has alert and oriented ×4. Now I'm also looking at her appearance. She's clean. I'm seeing her the way she's acting. She's not sleepy. She's not angry. No slurred speech. And then I'm on from there. So after I'm done with my full head to toe assessment. So I'm letting you know I'm done with my full head to toe assessment. Do you ever experience thoughts about hurting yourself or others?
No.
Okay, so I'm going to go ahead and document that too. Everything that I've done throughout this head to toe assessment, I made sure to document correctly. So no experience. And do you feel safe at this hospital?
Yes.
Okay, do you feel safe at home?
Yes.
Okay, so if you ever feel like you need to talk to me or any one of the staff, let us know. We are here for you and we can help you with anything. Before I leave, do you need me to do anything? Do you want anything? Okay, so now I'm going to go back up to the front. I'm going to hire her bed up. I'm going to put her railing back up. Before I leave you, I'm going to leave you the call light, so if you need anything, just don't hesitate to call me. Here's the call light. Okay, and now I am done with my, I said lower the bed, okay. So now I'm done with my head to toe assessment, and I'm done. So I'm taking my gloves off, disposing of them, and I'm washing my hands for 20 seconds per CDC guidelines, and I'm out.